My name is Madison Barker. Welcome to my TED Talk on leadership communication in nutrition and dietetics. So, imagine you're a dietitian trying to help a patient eat healthier. You give them advice, but they don't follow it. Why? Because just telling people what to do doesn't always work. The way we communicate matters, not just in patient care, but in leading teams and shaping organizations. Three main ways that we communicate as leaders. The first is one-on-one communication, like when a dietitian talks to a patient. This works best when we listen well, show empathy, and ask thoughtful questions instead of just giving advice. The second is team communication. This is how dietitians work together in clinics or hospitals. Good team communication needs to be clear direction, have trust, and have shared goals so everyone stays on the same page. The third is going to be organization-wide communication. And this is how hospitals, schools, or companies share important messages. This includes emails, meetings, and policies that help everyone stay informed and connected. All three models rely on clear messages, trust, and active listening, but they do differ in who is involved and how information is shared. Now, let's focus on one strategy that works really well. Ask questions to create ownership. So instead of just giving advice, we ask questions to create ownership. Why does this work? Because people don't like being told what to do. When you ask instead of tell, you make them think, take ownership, and feel motivated. For example, instead of saying, you need to eat more vegetables, try, what are some easy ways you could add more vegetables into your meals? This approach is based on three proven ideas. One is motivational interviewing, helping people change by guiding, not ordering. Emotional intelligence, understanding feelings and using them to communicate better. And the third is self-determination theory. People are more motivated when they feel in control. Telling people doesn't work. Asking creates change. So, what does this look like in a real-world setting? Well, when talking to a patient, instead of saying you should drink more water, you can say, what are some ways you could remind yourself to drink more water? Now the patient comes up with ideas that work for them. When you're working with a team in a clinic and starting a new meal program, instead of saying, you do this and you do that, the leader asks, what part of this project excites you the most? Now the team takes ownership of their own roles. At the organizational level, instead of just giving new rules, leadership asks, what do you need to communicate better with your patients? This way, staff feel heard and included in decision making. Great leaders don't give answers. They ask the right questions. And in nutrition and dietetics, when people take charge of their own choices, they are more likely to succeed. Thank you so much for listening today.